All right, welcome back to another episode of the Resilience Podcast. I think this is episode
20-something.
24 or 25, which is really cool. We were just talking about repetitions and how cool that is. And we have two very, very special guests, friends, members of Resilience, Dr. Nic and Nat. We're so excited that you guys are here. Thank you for coming.
Thanks for having us.
Thank
you for this.
This is awesome.
Yeah, we're very excited about this episode. I think there's going to be a lot of value for our members, people listening. So yeah, excited to jump into this, definitely. So why don't you tell us a little bit about yourself outside of work, and then we can dive into to the main topic on the podcast, which is perimenopause and menopause and women's health. Why don't you tell us a little bit about yourselves?
Let's do it. Well, the easy one is I'm the girl mom, Nic's the boy mom.
Yes.
So Nic has 3 boys. I have 2 little girls. We're wives, we're business owners. We have found a new passion for fitness. We've stepped into the High Rocks competition, which has been really fun. Thanks to you guys in this competition. So that's been amazing. And we're entrepreneurs. We've been entrepreneurs for 13 years. And we run our business and we get to do it together. We're identical twin sisters. As much as we look alike, we're different.
Yeah.
That's us.
And we're entering into our sports mom era. And so our kids' calendars and their sports are starting to take over a little bit. But it's
Go
really
Jays
fun.
go.
Right? Yeah.
Big baseball family,
baseball
right?
in mine,
Baseball families, yeah.
And, but it's been a lot of fun. So much fun, like hanging out on the sidelines, cheering them on, watching them in their passion, and just getting to witness that.
Amazing. And you guys are both Marauders. McMaster, is that right?
McMaster Marauders, we weren't elite athletes. My hubby was.
He played football, right?
Football and rugby for Mac.
Yeah. Wow.
I just cheered on the sidelines.
Yeah.
Is that how you guys met?
Yeah, at McMaster.
Awesome.
Cool. And where are you guys from? Where did you grow up?
Pickering.
We grew up in Pickering.
Okay.
Grew up in
Yeah.
Pickering.
Durham natives.
Totally.
Yeah, went away to school, came back, went to Australia for a little bit in part of our undergrad, came back, and when we were looking at like setting up our clinic, it was really natural to do it in our hometown.
Amazing. Speaking of which, did you guys always kind of do things together, or was there a period in your lives where really you guys separated and had a couple years apart, or were you guys always at the same school, traveled together?
Yeah, so we did travel together.
Yeah.
We ended up at same schools, but I feel like the way we got there wasn't the like, we're doing this together as twins. We weren't like locked arms.
Yeah.
It just sort of happened that way.
Amazing.
So we both applied to kin. We both have kin undergrads from McMaster. We applied. Nic got in first. I had to wait for my acceptance. I got into different schools, wasn't sure where I was going to go. Mac had just sort of a great kin program at the time, so we both stepped into that. Yeah. And then in terms of becoming naturopathic doctors, I always thought I was going to be a physio.
Okay.
I went to kin. That felt like the natural progression. And I was volunteering at a physio clinic and stepped into that and recognized that I loved the initial assessment. I was like, I love the like problem solving. What's wrong with the joints? Why is this person in pain? And figuring that out. And I was like, I'm less jazzed about the rehab program that follows, but I had this real love for that problem solving.
Yeah.
And I think people think we grew up in a household where naturopathic medicine was just part of our upbringing, and maybe our parents took us to naturopathic doctors and like
Couldn't be further from the truth. Right? They were into real estate, they were very corporate, like not.
But I think through our undergrad and through McMaster and kinesiology, you learned about the power of prevention and exercise as prevention.
Wow. Okay.
And I remember that in my like exercise physiology classes being like, exercise can prevent diabetes, and exercise can help prevent osteoporosis, and exercise can prevent all these chronic lifestyle diseases.
Yeah.
I was like, oh, that's powerful. That's medicine. Like, that's amazing. And I remember having this like inquisitive nature for like, there's got to be more to that. There's got to be more to that lifestyle story than just exercise. Like, that is obviously a really important pillar, but there's got to be more to that. And then at the same time, when I was at the end of high school into our undergrad, I had really bad acne, and Nic didn't. So I would go to these doctors and they're like, oh, like, it's bad luck. I was like, not gonna. They're like, I have a genetic identical who doesn't have that. Like, what am I doing differently in my diet and my lifestyle that is causing this? There's got to be a reason. Like, my like inquisitive brain could not appreciate that was just like bad luck.
Right.
So then I started doing like a deep dive into certain things,
and that's what really sprung you on.
Yeah.
Wow. Okay.
Yeah.
So it's like a personal experience
Little
that
bit,
really.
yeah.
And you as well?
No, for me, I didn't know what I was going to do. I graduated with a kin degree, and I wanted to pursue health, but I didn't know which field, and I started working as a personal trainer.
Okay.
And so
I didn't know that.
Yeah. So
All right,
Nat
cool.
and I, we actually both did. And we were training women. We were in a women's only gym, still exists today. And I could just see the changes that were happening in these women's health. And I was like, I want to know more about this. And Nat's like, well, you know, in September, I'm starting this naturopathic program. I think you may be interested in doing it. And I think I was maybe trying to find my own way and not just do the stereotypical twin thing and do the same thing. And, and then we ended up starting together and graduated together, and yeah, the rest is kind of
incredible.
Yeah.
When you guys were in school doing that, were you guys talking about maybe opening a practice together, or?
It was always the dream.
Love
it was
that.
always the
Family business.
Yeah.
But it was always a 5 to 10 year plan.
Yeah.
We were like, when we get out of school, we're going to work for like another clinic separately. We're going to like build a patient base, and then we're going to do this together. And Nat joined a team of chiropractors, and I went and worked with a naturopathic doctor, and I had a great setup. She ran the clinic, everything was great, and everything was really well supported for me. And Nat was kind of running her own practice, micro clinic, in this chiropractic office, and very quickly said, like, we can do this on our own. I'm already doing it on my own.
Yeah.
And so what was the 5 to 10 year plan became 8 months after getting our license, we opened the doors. So we started planning really early on, and
Just took a leap of faith.
just
I think.
took a leap.
Just sort of like,
we had
okay.
passion and a drive, and knew that we could help people, and just went for it.
So let's talk about the inception of the Durham Natural Health Centre.
Yeah.
2012.
Correct.
Is that right?
Yeah, correct.
So that's when it all started.
Yep.
Can you guys take us through that, the launching of that,
Yeah.
and how that started,
Yeah.
and bringing
Yeah.
you today?
Yeah. So it started really micro. It was Nic and I. We were the only
Two bodies in that place.
two bodies in that place, and I would practice and Nic would play reception for me, and then she would practice and I would play reception, and we were literally like picking up the phones but just doing what we could, keeping overhead low, you know, just like we had taken a chance, we'd taken this like financial risk,
But
and
we got a space that was bigger than that.
Yes.
We had gotten a place with 4 treatment rooms, knowing that we wanted to expand and grow. But
amazing.
our big mission and vision with the clinic was always not just to fill treatment rooms. I was like, I do not want just random clinicians. I want good quality clinicians who see the vision, who are invested in doing things the way that we do things, and really having. We were always really focused on like the right people.
Right.
We were like, I want the right people. I don't just the overhead will be the overhead. We'll figure it out. But like, I just want to make sure we have the right people. And so we slowly started to grow our team.
So it was like a vision. You guys believed in it. Reminds me of Field of Dreams. Build it and they will come.
It's funny we say that all the time.
Opened up a four room place and filled it.
Yeah.
Totally.
That's incredible.
Yeah.
Can you guys take us through the foundation and the mission of what it is that you guys do?
Yeah, so I feel like it's evolved a little bit. Like
Yeah.
when we first opened the doors to the clinic, we just had this vision and this desire to change the health of our community one person at a time.
Yeah.
That was literally like our mission statement. I was like, if we can change the health of one person at a time, we can change the health of our community, and that felt really powerful at the
That
time.
is very-
and it was
that
it
packs
was-
a punch.
right? And
Yeah.
it was amazing because we would see it. I'd be like, the mom comes in, we work on her health, and then that has a ripple effect. Now she's feeding her kids differently. Now her husband's asking questions. Like now that's having an entire ripple effect on that family. And then beyond that, it goes to their friends. And we were just like, okay, so we were very much a family-focused practice at the beginning. We didn't have like a niche. We didn't have
You're serving everyone.
everyone. I was like,
Yeah.
we can help everyone. If people start exercise, they start doing this. Like it was very global.
But it was women who were reaching out.
Yes.
It was mostly women who would reach out, and
But then there was a shift that happened.
yeah.
Can you
So
speak to that?
in 2020, when the world shut down, the pandemic happened, we went from these like fully booked practices with wait lists to now massive gaps in our calendars. Everybody was canceling, right? And pivoting to virtual was just like not really. People were like, I'll just wait it out.
Yeah, yeah. Right.
I'll come see you back in person when I can see in person.
Yeah.
And as the weeks and months went on, the first people who started to reach back out were women in their 40s and 50s. They were struggling. They weren't sleeping. Their moods were changing. They were under an incredible amount of stress. They were trying to work at home, probably virtually schooled their kids. They were, stressed with like the landscape of the world. And I remember picking up the phone at the end of one of our practice days and saying to Nat, like, is it just me, or are these women really struggling, or is that just what I'm seeing all day? She's like, no, I'm seeing the exact same thing. And what we realized was like, we weren't the first people that some of these women were reaching out to. They were reaching out to other clinicians, and they were being offered sleeping pills and antidepressants and different medications to help soothe their symptoms. But they knew that something like was shifting in their body. They were like, there's something changing. There's something, I need to sleep, but there's just something changing. And we realized in that moment, I'm like, it's their hormones, and we need to really do a deep dive on this. And so it was from basically 2020 onwards, we joined a fellowship with other clinicians around North America to deepen our knowledge in that. We got certified with the Menopause Society. We got our whole team certified in this, and we've really been focusing exclusively on perimenopause and menopause ever since 2020.
Wow.
Yeah.
So this is your niche, and this is who you serve, and you don't serve. So do you take any other like clients on that aren't interested in this, or is it just this for the niche now?
Yeah, I always say we will. I won't say no to somebody. Like, I think that there's services that we can offer to help most people, but that's really sort of our area of focus.
Yeah, that's what we do well. We'll refer out if it's not the right fit.
Yeah, for sure.
We're excited about this podcast because I would say at Resilience it's probably 55% women, 45 men. That's educated guess, maybe 60-40.
Yeah.
But even as men, this can help support us in our significant others as we journey with wives and understanding what is happening. You guys use the word the shift.
Yeah.
And I watched a couple videos of you guys, and that was a term that you guys used to describe this kind of shift in not only age, but like perimenopause, then menopause. Can you guys educate the listener on what exactly that means?
Absolutely. And I love this. We had an event last night, and there was a group of women that were there, and it was amazing. And there was one husband, and I like applauded him for being there. I called him out a lot. I was like, I'm so happy you're here, because if you can understand this, you can help support your wife. You can come alongside this journey.
Right.
So perimenopause is the years leading up to menopause. Menopause is defined as one day. It's when you've gone an entire year without a period. Perimenopause is that messy middle before that. It's those turbulent years of hormonal kind of chaos. Some people will describe it as like a reverse puberty. So as hormones are entering the system in our teenage years, this is where they're sort of leaving the system, and it can come with a lot of symptoms.
Okay.
And Nat mentioned that menopause is one day, which I think surprises a lot of people to learn that. Every day thereafter is considered post-menopause, although many people will still use the term menopause to define that time frame.
So hormone-wise, like pre-perimenopause, if that's a word, we're kind of stable hormone-wise, and then during perimenopause, does it really fluctuate into that day of menopause?
So what happens is when we're cycling normally, there is this really predictable pattern, this really predictable rise and fall of estrogen over a 28 to 30 day time frame, give or take. And this really predictable sort of increase in progesterone after ovulation. And it's all very, very predictable. And so a lot of women sort of navigate that sometimes with relative ease. When we start to enter into perimenopause, the progesterone levels start to gradually decline over that time frame, and estrogen gets very erratic. It goes up and down and up and down and up and down. And it's not the absolute numbers of where the hormones are. It's this up and down fluctuation is what women feel.
Is the up and down fluctuation during the 28 and during the cycle, or is it like every month is different kind of thing?
So there's stages of perimenopause. So in the early stages, we'll still have like somewhat predictable cycles, but they might start to bounce around by like 7 days. So if you're used to this like predictable 28-day cycle, all of a sudden it's like 35 days and 21 days. So there's still a little bit of predictability in the hormones there. And then you get into like later stage perimenopause, where we're going greater than 60 days without a period. So we're not ovulating every single month. We're not getting this predictable rise and fall of hormones that we would normally anticipate. So it's pretty chaotic, because we don't have a compass. We don't have a guide. We don't know where that is. And women will come into my office and say, and we'll say, okay, you're in the late stage of perimenopause. And they're like, when am I going to hit menopause? I'm like, I don't have a crystal ball.
Right.
I don't know.
Is there a test? There's no data-driven test.
So that surprises a lot of people, is that they're like, well, how do I know if I'm in perimenopause? Like, can we test it? Can we test my hormones? That's the first question many people come into our office is asking. It's time to test my hormones. Something's shifting. I feel it. Can we test it? testing isn't helpful in perimenopause because of that erratic nature of the hormones.
Yeah.
So this is why a lot of women get dismissed. They get their hormones tested, and they're told everything's fine. Well, it's fine that day.
Yeah.
But next week or next month, it might not be. And so perimenopause is defined actually in a doctor's office. It's a clinical diagnosis. So we talk about cycles, we talk about symptoms, and based on age and sometimes the exclusion of other things that may be causing those symptoms, then we diagnose somebody with perimenopause.
What are some of the symptoms that some women might experience?
A long list. But no, I'd say the things that usually prompt women to notice a change are mood changes.
Yeah.
So a lot of times it could be all month long, but often what I'll find early on, it's the week leading up to their period. So women are like, they feel like they're PMS, like they're like, I didn't really have this in my 30s or 20s, and now I just feel like it's like I'm irritable, maybe I'm anxious, I'm snapping at people like my family, and I don't normally do that. So mood shifts we start to see. Sometimes it can be depression too. And we'll see weight gain. Women hate this, so that is something that happens, and it's usually more like the midsection weight gain. What women usually think about, and sleep, yes, and insomnia, that's a big one, is that sleep gets disrupted.
So those are like the early symptoms that we'll generally see.
Signs,
the early signs.
So when women are coming into your office and they think they may be going through this, is it usually the physical that they're noticing? Is it what do you guys notice mostly first that they
Sleep and moods.
Sleep and moods are generally, and oftentimes we'll see that when you do still have like a bit of a predictable cycle.
Okay.
So it's like there's maybe my flow's changed. It's a little bit heavier than it was, but it's still relatively every 28 days. We're just starting to shift, but they're like, I don't feel like myself for the week before my period. I can't sleep for a few days. My moods are off. And what we always hear when we talk about perimenopause or menopause is you hear hot flashes. So a lot of women are like waiting for that, like, it can't be menopause. I'm too young for that, or this isn't me, and I'm not having hot flashes yet.
Yeah.
And the reality of like the hot flashes and night sweats is they come later in that transition. So they happen when estrogen hits like a new low.
There sounds like there's many dynamics to this: psychologically, physiologically, emotionally, physically. Does it really encompass all those different areas of life?
It does. It's a full body transformation. We have estrogen receptors everywhere. We have estrogen receptors in our joints. Some people get joint pain out of nowhere. Brain fog, itchy ears, like mood changes, sleep issues, vaginal changes. Like the list is long.
And it impacts women's ability to to show up. Right. And so brain fog is a big one for a lot of women. They get brain fog, and so they start to feel it's impacting them at work.
Yeah.
Like, I can't learn a new task, or, they're not sleeping well, and so they're not showing up for their morning workouts, or that's really can have a huge impact.
As time has gone on, is this recently, there's been more light that's been shed on this as of late? And was there more ambiguity before in prior years? Is that coming to light now, or what's the shift there?
Yeah, I think, yes, absolutely. I think that there is like a conversation that is happening that is needed, and it's amazing. I think there's a massive gap in education in both the medical field and the naturopathic field. All of our menopause learning happened after graduation.
Yeah, we got
like very little education in this.
And that's not dissimilar from the medical profession. That's from medical school as well. Really, and so there's, women will go in and they'll go into their physician's office and they'll say like, my moods are shifting, or I'm not sleeping. And it's like, well, here's an antidepressant and here's a sleeping pill. And not that those are wrong, but they may not be addressing the root cause, which is the shifting your hormones.
Throw on top of that every person is different.
Yes.
And there's different variables and different subjective sort of parts to this, right?
Yes.
You can't pinpoint one certain thing.
Totally.
Every one of your patients is really going through things differently, right?
Yes.
For sure.
Does that put an extra challenge on it?
Yeah, and I think one of the hallmarks or the tenets of naturopathic medicine is individualized medicine. So we always approach each case sort of individually, and I always tell patients there's multiple ways to get to this health goal we want to achieve, and it's up to us to put together a plan that's going to fit you and your lifestyle, and what's going to work for patient A might not work for patient B. So we need to have a bit of individual variability to it so that we can help you get there.
Just like fitness.
Just like
Just like our members. That's what we do, buddy.
Totally.
Knowing that everyone is different, when someone comes into your office, how do you go about assessing them, and what can they expect, or as they their treatment? Everyone's different, but I saw that I was watching your graph, and you guys focus a lot on nutrients and sleep at the beginning,
Yeah.
and then it goes into
Yeah.
hormones and
Yeah.
then diet and exercise and then
Yeah.
longevity. So how do you guys assess someone that's coming in?
Yeah, so we have a first visit, and we have the luxury of time with patients. Our first visit is like over an hour, so it's 75 minutes, and so it's not this quick. What's your one symptom? Here's your one solution. We get to know the patient, and I always say I want to know what's bringing you in today, what your concerns are, but I also want to know all of the habits that you have. I want to know how you eat. I want to know how you sleep. I want to know your stress. I want to know like your boundaries with work. Like I want to know all of it so that we can put together a plan that is going to be doable for you, but also address some of your main concerns. We focus we have 4 pillars that we work through with patients, and the first one is sleep and nutrients. It's really hard. A lot of times women will come in for potentially weight issues, right? They have hot flashings and, they've gained weight. And they expect us to talk about diet and exercise first.
Yeah.
And I would say it's really hard for us to show up for fitness or meal prep and do all the things we need to do if you're not sleeping.
Absolutely.
And we've been doing this long enough to realize, I'm sure in my early days of practice, I would probably put together some lofty diet plan on day one, but now, we've realized like you have to sleep.
Yeah.
And we need to make sure you're not deficient. The amount of women who are navigating their 40s, whose periods are now usually in the early start of perimenopause are closer together and heavier, that are iron deficient is a lot. And so we will run labs and we will run blood work so that we can get an assessment of where that is so we can fix those first. We're also layering hormones, so we'll have a conversation around, do we need to be doing hormone therapy? Is this something that we want to be layering in as part of your plan? And it's not until pillar 3 that we start to talk about diet and exercise. Because once these pieces are established, then we can start to really move the needle. And I said that's when the fun part starts. Like for us, that's when I'm like, oh, okay, now this is like the fun part. And then we really talk to women about their longevity plan. There are, I would say the decisions that you make at midlife are going to dictate your health 2 to 3, 4 decades from now. And so, we want to put together a plan so that you have strong bones, so that we're preventing cardiovascular disease, so that we are, preventing diabetes and these chronic illnesses that come up. And so and then again, we have the luxury of time, right? We spend time with our patients. Our follow-up visits are 30 minutes, sometimes 45. Like we have time to do this with our patients. And, which is really a really beautiful place to be able to hang out, because I think a lot of times patients will go and they'll get like their annual blood work done. They might be diligent and show up for their medical appointments in the conventional system, and they're like, I got my labs and everything looks good, and I'm like, I'm healthy. And I always say like there's a difference between everything being fine and then living your optimal life or being as healthy as possible. The absence of symptoms doesn't equal health, right? And so what are we doing, to help support you on that?
Wow, that's a lot. There's a lot there. I have a lot of questions.
Me too.
The iron one, like you said, a lot of the women come to you, they're iron deficient. What is the symptoms of that? And like, is that something like sometimes you give a client iron and a lot of problems get fixed, or what are some symptoms?
Great question. So we will run blood work, conventional blood work all the time on patients, and we screen for that and we look at that. And one of the big things is fatigue. We can see hair loss.
Mood changes.
So low iron is a risk factor for anxiety and depression. So we'll see that like physically, you can see people being really pale. That happens a little bit more in like advanced stages of that. But you can see how those symptoms really overlap with some of the perimenopausal symptoms we were just talking about, right? So I'm having mood issues. I don't feel like myself. I'm fatigued. Like there's this overlap that happens. So sometimes when we correct that, and ways that we'll do that, we'll either do that through oral supplementation. So put somebody on an oral supplement, they'll take that for a little while, then we'll retest it, make sure their levels have come up. There can be GI issues with that. Some people get gut issues when they take an oral iron. There could be compliance issues with, I'm forgetting to take this darn pill every day. So we have other options in our clinic. One of the things that we do, our nurse practitioners actually do this in our office, is they'll do iron infusions. So it's gives you an iron boost. We don't worry about
like an IV?
An IV drip. Yeah, an IV iron drip.
Get it right in you.
And it gets
right in you, and it bypasses the GI.
Okay.
Right. So when we go IV, we go right into the bloodstream. We're like having so we can see some really beautiful shifts. We actually had a patient last week. I bumped into her and she told me she's done 3 iron infusions. She's like, it's the first time in years I haven't napped.
Wow. Oh, wow.
Like
Incredible.
Like, so, whether that's through IV iron or just repleting iron through oral supplementation, it's just like when we can get levels up, we can show up the way we want to show up.
But there's sort of like another thing to keep in mind with raising iron levels is that women are they're low because a lot of times their periods are really heavy.
Yeah.
So I would say it's like we're trying to fill a bucket with a hole in the bottom. Like we can stuff iron in all day, but we probably need to have a strategy to try to manage like the bleeding and like the fact that your periods are changing. So we're often having conversations about sort of repleting, but then also how are we going to manage this for you till you eventually hit menopause?
I have a couple more questions.
Yeah, me too. I love how it's broken into pillars, kind of.
Yeah.
You know, with sleep and everything, and then hormones, and then I have a lot of questions about fitness and strength training and how important that is in women between 30 to 50.
Yeah.
It's massive.
So huge.
Love to hear more about that.
Yeah.
But I know you probably want to ask a couple questions.
No, I was going to go into the second pillar, the hormones, because I had a lot of questions about.
Yeah, well, let's
hormones.
go one pillar at a time. We'll go hormones next, and then we'll go to the
Follow our
fitness.
plan.
Yeah, I know. I'm trying. That's pillar 3. Wait, let's go back to pillar 2.
So hormones. The thing that I don't understand that you said that perimenopause, the hormones are all crazy. So do you guys not do anything with hormones when you're in that zone? And then I also was curious about like what kind of hormones and what are women deficient on as they go through perimenopause and menopause, and like how that helps you.
Yeah, great question. So a lot of times women are really sensitive to that ebb and flow in hormones. So when we add in hormones, and oftentimes we're adding in estrogen and progesterone, we're trying to create stability.
So it's bumpers. Like
We're trying not to let you
like
like bottom out.
Yes.
It's that ebb and flow. A lot of women will feel this postpartum, right? We have a huge drop in hormones postpartum. For a lot of women, they get mood issues and they don't feel like themselves and all of that. That's like a really obvious drop. In perimenopause, we get this erratic nature of it. So when we're adding hormones, we're just trying to create some stability at the hormone receptors to manage how you're feeling. So a really common prescription involves like a topical estrogen paired with an oral progesterone.
Okay.
The oral progesterone is required if you have a uterus. If we give you just estrogen and you have a uterus, you will grow your uterine lining and you can lead to cancer. So we need to add in that progesterone to stabilize that. Progesterone shines in terms of helping with sleep and helping with anxiety. So that initial symptom that we see in perimenopause, we were talking about mood issues and sleep issues, is because progesterone's that first hormone to drop off. So we give the progesterone, but then we'll also layer that alongside the estrogen.
Okay.
But most women are symptomatic leading up to the loss of their period, right? In the perimenopausal years is when most women have the symptoms start. And so we wouldn't wait until menopause to start these hormones, because this is often what helps women feel better.
Okay.
And so we start it during those kind of turbulent times.
My next question about this is the hormones. Okay, so is it very steady from like pre-menopause, like before you hit pre-menopause? Are women like steady like this, and are you trying to get them to that steady range, or do they? My question is like, do you you hear a lot about TRT for men, right?
Yeah.
Testosterone for men, and a lot of times they're prescribing them at like a 30-year-old level or a 25.
Yeah.
Is for women, is it it's like there's like a level and it doesn't really deviate from that level, and you're just trying to get them to that level? Are you you trying to get them to like a 20-year-old level, 25-year-old, or a 30-year-old level? How do you guys prescribe in that level?
I always just say I'm trying to get you off the floor.
Okay.
When you're menopausal, estrogen and progesterone has left. There's
really?
no value in testing. Patients are like, if they're like, we should test my hormones. I'm like, we don't need to. They're zero.
Really?
And so I would say our goal at that point is just to get you off the floor. And so we're just giving small doses. We're not giving heroic levels.
And we're not necessarily testing to appreciate where our values are. We're looking at clinical picture. So we're looking at like, how do you feel? Are your hot flashes gone? How are your moods? How are things? We're not always using blood work to guide that like you would with testosterone.
Okay.
Testosterone we will use in women. So it is used for like low libido and a postmenopausal women, and our nurse practitioners will prescribe that. With testosterone, we will monitor blood work.
Okay.
Because we worry about going too high with that one.
Of course.
With the estrogen and the progesterone, we're using like low dose, pulling you off the floor. We're not worried about like super dosing you. And we're just managing symptoms and watching symptoms.
That makes sense.
You're coaching them through this transition.
Yeah.
You're holding their hand through this period of life that can be confusing or challenging, or maybe there's a lack of understanding around it. and you guys come in and coach.
Yeah, it's fun.
Yeah.
It's really fun. And like, I think when we get to pillar 3 is when I really get to put on my coach hat, when we go like diet and lifestyle, and I'm like, okay, now we're ready. Like, this is fun. We've got you like feeling like yourself again. Like, now let's get into the fun stuff, and let's talk about like longevity and like, and we get to talk about diet, exercise, passions, purpose. Like, it's really exciting.
Yeah, let's go into pillar 3 then.
Yeah,
I'm sure we could
it.
really dive deeper into pillar 2. I don't know if you have any more questions or before we move on to pillar 3.
Is that the only hormones you guys prescribe, or is those two the major ones, and then testosterone a little bit as well?
Yeah.
Those are the 3 major ones?
Yeah, and then we'll use vaginal estrogen. So
Okay.
like a local vaginal estrogen. Oftentimes women will get a lot of like vaginal dryness, atrophy, pain with intercourse, and then we'll use like a local estrogen for that.
Okay.
But that's typically standard. Not every woman needs testosterone. There's a unique case where we will prescribe that and it has a use and a place, but not everyone needs that. But definitely the estrogen and progesterone. And maybe to back that conversation up, like, we feel pretty strongly that every woman just deserves to have a conversation, an evidence-based, informed conversation about hormones, and then
Yeah.
you get to decide if they're for you.
Yeah, okay.
So not every woman needs to jump on this, and for some women, they're like, you know what, I don't feel aligned to that, or
Yeah.
but you deserve to talk through it with someone
Absolutely.
who can take your family history and your health and help put together a plan for you and decide, like, is this the right move for you? Is this what we want to do? Or here are some other options.
There's still a lot of fear around hormones, right? So in
definitely.
2002, there was the biggest study ever done on hormones, and we pulled almost every woman off of their hormones in 2002.
Really? I didn't know that.
Yeah, it was the Women's Health Initiative. It was the biggest study, and it was using the wrong patients. So the women were too old. It was using synthetic hormones. It was using oral estrogen. It's not how we do hormones in 2025.
Okay.
But there's still a lot of apprehension. Like, I had a new patient yesterday, and she came in and she's like, well, my doctor talked to me about hormone therapy, but I'm here because I don't want that. And I said, well, can we just have a chat? And I had the beauty of having time with her. She told me all of her fears, and I shared the data, and I talked to her about it. And, you know, and sort of at the end, she was like, oh, I feel much more comfortable with this decision. But with a 7-minute appointment with a prescription pad, like, I just didn't have a chance to talk about all of these things, right? But we don't do hormones today the same way that we did back then. But there's still a lot of stigma that's been carried through.
For sure. Are these, last question before I move on to diet and exercise. Is this something insurance companies usually cover? Is it like they see it as like...
Yeah.
Okay.
It's a prescription. It's a prescription. So we oftentimes, we're using like body identical hormones or bioidentical hormones that are generally Health Canada approved.
Okay.
So you can grab them from your local pharmacy. They're estradiol and progesterone. They are, in a drug package, but they should be covered by your drug plan.
Amazing.
Yeah.
Awesome. You guys have seen a lot of success with those changes and helping people through that.
Yeah, and I mean, we're big to say that menopause care is about so much more than just a prescription.
Right.
So that is an element of it. That can't lift weights for you. That can't put you to bed. That can't manage your stress. Like, we need a whole body comprehensive plan. So I always say it's the small piece, and for a lot of women, it's the lever to get them feeling better, so then we can access all the rest.
Yeah.
Which
That's
is
amazing.
which is where the fun begins.
Okay, let's go to the fun.
Let's go to the fun.
So let's talk about pillar 3.
Yeah.
Fitness.
Yeah.
Yes.
And nutrition.
Yeah.
Okay, so as a fitness professional myself, I've seen a huge shift in women's fitness. Kind of maybe 10, 15 years ago, the goal was to be skinny or, a lot of aerobic movement. But now there's such a beautiful focus on strength training.
Yes.
And
Yes.
it's clear that it helps bone density, it helps muscle, it takes up space.
Yeah.
It's good, it's healthy. How important is that in this journey through perimenopause and menopause?
So important. I think it is really important for women. I think it's equally as important for men. Like, I think we are at risk for muscle loss if we start to lose muscle in our 30s. And part of the weight frustration for women has to do with a couple of different factors. One is that we start to lose muscle. Women start to lose muscle. As we move through perimenopause, we have an acceleration of muscle loss. We also know that we just talked about women don't feel great. So, showing up for our workouts and doing those things is not easy. But with that loss in muscle mass, we have a drop in our basal metabolic rate. We have a drop in our metabolism. So now we're like doing the same thing we used to do. We're eating the same. We're working out the same. We're doing the cardio. We're cutting our calories. nothing's shifting.
Right.
It's not working.
Right.
I
Probably
don't-
feel worse.
Feel worse. I'm
Yes.
tired. I'm depleted. I'm not eating enough. I'm not fueling my exercise, and I'm just further like losing muscle. So strength training is your tool, your ticket to helping to improve your metabolism.
It's also your organ of longevity. And so I talk a lot to patients about we really want to be banking this at midlife. It's going to be a steady loss. We are going to be losing muscle at an accelerated rate. The older we get, the faster we lose it. So we need to be preventing that as much as possible. If we want to be able to be independent and living on our own and lifting groceries and doing things at 80 and 90, that starts with what we're doing at midlife.
Yeah.
So really your 30s and 40s and 50s, there is an opportunity
It's a beautiful
to
opportunity.
make deposits.
Yes.
I mean, you really have a choice. It's not too late.
Totally.
And it's never too late. I mean,
Yeah.
you can build it at any age, but the sooner you do, the easier it is. And I say this to women all the time, and I use that exact statement: is this is your opportunity. What do we want to do? How do we want to show up?
With such a focus in women's fitness with things like Pilates or other things like that, which are great. It helps you with your peripherals. It helps with
Mobility.
your mind-controlled mobility. Strength training is it really, really important to also have that aerobic mix in there? You're training high intensity as well. Because as a female goes through a month of sort of changes and in different phases in the month, I'm sure there's focuses on training that probably help at certain times of the month. And how do you even navigate that?
So I always tell patients, you want to listen to your body, right? So if you have times when you feel more tired than the other, you may want to pick different exercise for that time frame, but you don't have to follow a certain, like there's some people who do like cycle syncing workouts and you have to do this at certain time. Like, just listen to your body. We don't need to complicate it, just show up.
Right.
But I think it's incredibly important that women focus on strength training. But I think what ends up happening sometimes is we get this narrative of like, oh, that's all we need to do.
Right.
And like, that's not all we need to do. Our biggest risk factor for our health as a female is cardiovascular disease.
Game day.
Right?
I had to throw that in there.
Big plug. And so we need to be doing cardio.
Yeah.
Right?
Yeah.
We can't, then this is the challenge of fitness is that we get all in on one bucket, right? Like I do Pilates 7 days a week. Well, that's not lifting heavy weights. That's great for mobility. You're moving, you're not being sedentary. Awesome. It's not stimulating your bones and your muscles the way that strength training does.
Totally.
And we have to do more than that, right? And strength training doesn't train your cardiovascular system the way that it needs to be trained. And neither does, and I say this often to patients, I'm like, you're fitter than a walk. Like your walk is great. It's slow, steady cardio. It's important. It's not replacing high intensity cardio. Women need to be doing like sprint intervals.
Game day.
Yeah.
Let's go.
But they do. Like if we talk about visceral fat and we talk about the fat in your midsection, the way to burn that is with sprint intervals. Right? And so we need to be doing that. So we have to have this balanced approach to fitness.
Yeah.
Right? We need to make sure that we are covering all these boxes: mobility, low intensity cardio, high intensity cardio, and strength training. And that we do that. And sometimes that sounds wildly overwhelming to my patients who are sedentary. Right?
Yeah.
Like, okay, I always say we just have to get the boulder moving. Just show up, start walking, do something. We'll worry about where this boulder goes and which direction we're going to point you to once you just start taking action and showing up. But that's sort of the ideal plan for women.
What do you say to a woman that comes to you, and I'm sure that happens a lot, they say they just don't have time to do it, or
Yeah, it's tricky. I say we gotta make time, and we gotta like identify your priorities. And sometimes we're having really tough boundary conversations. Sometimes I'm having them like time audit. Where are we wasting time?
Or what can you delegate? There's a lot of things in life you can delegate or hire for or whatever, but you can't do that with fitness.
No.
Only you have to show up for it, right? So sometimes it's having those conversations around, like Nat said, time audit, and do you still need to do these things? But it's also a conversation around priorities too.
Can you guys share a little bit about your own experience implementing strength training and how much that's helped you?
Yeah. So Nick shared we were personal trainers years ago. So we were in the gym, we were lifting weights, we were doing the things. That was all through our university years. And I would say we've always maintained some level of fitness. But then you enter kids, and getting to the gym was really hard, and throw a pandemic in there. And I was like, well, how are we going to do this? So everybody bought a Peloton, started doing Peloton workouts, which was good. I could get a good sweat on, did some weights at home, did that for a little bit. Then it was 2 years ago, we're like, okay, we're ready for a gym again.
Well, no, we hired a trainer. We did a
Oh, that's
virtual
right.
thing. We hired a trainer and did it online in our homes, and we would log in twice a week, I think it was, and do like a strength training with kids running around, and very not practical, but it was the way we got it done. And so that was, maybe 2-3 years ago. And then, but we were reasonably consistent. And then, I think we just both realized like we were just not being consistent. You know, we showed up for the 2 times a week for a little bit. But it wasn't the level that we both wanted it to be. And we both had to just make a decision for ourselves that the only way for us at this phase of our life to be consistent was that we have to just make time for it. And it's going to have to be in the morning. No one needs me at 6 a.m., 5:30 in the morning. Nobody needs me. Evenings, weekends, there's all these other people who need me and all these other commitments. And so we had joined another gym in June of last year, I guess. And then 2 months later, and we were showing up in the morning, doing the morning classes, and 2 months later they shut down. And I was like, I can't lose steam. I was like, I need something like this closed down on Friday. I need something on Monday because I can't go back. We were starting to feel really good, and then we joined here, and really haven't looked back. But it was a slow progression. It was a slow evolution of seeing where we were kind of bumping up against walls in terms of not being consistent, and seeing what we liked and didn't like, and it's been awesome. I
think it's done 2 things. I feel like it's refueled my idea, and what got me into naturopathic medicine is exercise is medicine.
Yeah.
And it really is medicine.
Yeah.
And I've also loved the intersect that I've seen for myself, but I also see for patients is that physical strength translates to mental strength.
Yeah.
And to me, fitness and weight training is it's more mental. The physical's nice, whatever, but it's a mental game.
Yeah.
And how that's translated to our business, just our ability to handle more stress and take on more, and all of that, and do hard things has been a lot easier since we've been more consistent with this.
I think there's a tipping point. It's for people that never do exercise, it's always hard to start, and then once you start, it's hard to not, you can't imagine not going.
Totally.
I say that to patients, I'm going to
painful.
sound crazy, but you're going to start to crave it one day.
Yeah, absolutely.
Well, that's a strange place to land, but I'm but that's what happens. You just, you can't imagine life without it. You need it. It's your medicine. It's your drug. It's your...
Yeah, I feel I've dragged a couple of really good friends into a fitness journey, and one of my girlfriends was like, oh my God, we went on vacation, and she's like, we're going to go to the gym in the morning. She's like, I used to think you were crazy. I'm like, I know. I know.
That's awesome. That's so good. And coming to resilience, I can't help but plug resilience.
Yeah,
like plug,
do
but
it. We plug you guys. We brought some patients here. Some people.
I've been dragging patients here.
I love it. Thank you. It means a lot. The power of community. Let's talk about that for a minute, because since you guys have been coming, even right now, we're doing community right now.
Yeah.
We're sitting at a table talking, and originally we connected through fitness.
Yeah.
You guys came in to have a gym experience, but the power of community, and as someone's going through perimenopause, menopause, looking for a fitness community, have you seen massive success with your clients and your patients that are plugged in with you guys, connecting with you guys on a weekly, bi-weekly basis, doing things like the gym together? How important is community to you guys?
Yeah, that's a great question, and something I think we knew, but was amplified when we stepped through to resilience. And we recognize the power of that support, that accountability, that commitment to somebody else. Sometimes you're like, oh, I'm coming to class on Wednesday. I told you to be there on Wednesday.
Yeah, totally.
You take it out of yourself, and you're like, oh, I told Steph I was going to be there. I don't know. Steph's going to text
That's
me.
it. That's the winning. That's the secret sauce, right? Yeah.
So we recognize that, and we recognize that when we stepped in here. It's so much easier to step into fitness when it's become fun, and I have friends, and it's great, and there's a community doing this hard thing together, and we learned from that, and we took that, and we ran with that into our own business, and we've now launched we've launched our what we call our Empowered Midlife Hub, where we meet for bi-weekly coaching calls with our patients to
let's go.
Because what we realize is I'm you can come in, I can give you the strategy, we can do the supplements, we can do the hormones. The diet and lifestyle stuff is hard.
Yeah.
It's hard. And then I would send patients on their way and say, come back, check back in 3 months. Let's see how you're doing. And they're like, I took the vitamins. I'm like, cool. Okay. Because the rest is really hard. So we started to create this container for us to come together. We started to do more in-person events. We just had one last night. It was amazing. For women to be like, I'm not in this journey alone.
Yes.
Everybody else is going through this. There's support. This doesn't have to be this terrible thing I read about on Instagram. This can be a place where I thrive and I do things. So I think community is everything when you're trying to move your health.
That's amazing.
Yeah.
Someone listening to this right now that's interested in getting your guys' help can now know there's also that community aspect. Like, I'm not in this alone. They got my back. There's other women that are going through this right now.
Totally.
It's like you're on a team.
Yeah.
And that's going to take you guys far, man. So I'm excited to see the evolution of that in your business.
Thank you.
It's going to be powerful.
It's been fun. I actually when we jump on those calls, I'm like, this is my favorite hour of the week. Like, it's so much fun.
Incredible.
Yeah.
Incredible. That's called your
Our
online hub?
Yeah, our Empowered Midlife Hub.
Cool. And then events as well.
Yeah, so we've been starting to do some. We did one last night. We did like a debunking menopause myths night. It was awesome. We got another event coming up. You
Yes, we do.
about that?
Yeah. Another plug. Let's go. We have a really exciting event coming up that I'd love for you guys to share.
Yeah.
Because we're pumped about it.
Yeah.
Yeah.
It's going to be great. So we are coming together. We are inviting the Resilience family meets the Durham Natural Health family to come together for a workout and education. So we're going to educate a lot more on the metabolism and midlife and the shifts and what happens on that from a hormone front. And then Kara's going to put us through an awesome workout.
Incredible.
And we're going to hopefully get some of our patients who haven't strength trained to do it.
Yes.
And to do it with support and to do it with like women who are navigating this themselves. And
So
awesome.
who is this for and how can they get involved?
Well, this is, I think, for anybody with any fitness level.
Mm-hmm.
You put together a lovely link, Eventbrite. We'll link it on your Instagram, our Instagram.
Click the link below. Right in the comments.
Put it in your show notes.
We'll figure that out.
Whatever I have to do. I'm not the systems in my business. And come and join us. It's a free event.
It's going to be for women like 35. The talk will be geared for women 35 to 60.
Yes.
Sort of in and around that age gap. Because we're going to talk about the shifts that are happening in your hormones, and they can sort of start then.
Yeah.
But if somebody wants to just come and learn, like even if they're younger and they want to just come and learn what's about to happen,
Totally.
they'd be more than welcome, right? Like they could definitely come because it's going to happen. If you have ovaries, it's going to happen one day.
Yeah, I would also say if you're older than that, like it might be validating to come and be like, oh, that's what I was going through. Because I think the lifestyle and habit shifts and the workouts, those don't change.
Yeah. I'm excited for it because I'm excited to get lots of people in the same room.
Yeah.
And then I think vulnerability happens, connection, and they leave feeling, okay, like I can tackle this with the help of Nic and Nat and the communities around me, and I'm not alone here.
Totally.
I have a wife, she's 38. Shout out my wife, Kara, love you. I have a sister, she's 43, 44. I have a mom, I'm not going to say her age. I love you, Mom. But they're going through stuff. And just to come together with, 20, 30 other women in a room is going to be something really cool. I'm excited to see what happens. So
Me too.
it's going to be a powerful event.
Yeah, I think so.
Really cool
I don't think we
opportunity.
said the date. November 16th, 12:30. Right here at Durham Resilience.
Yeah, it's going to be great. I'm excited.
Yes. Before, because we got to end in a few minutes, I wish we had more time because there's more we could go into. And I feel like we're just heating up. I always feel like in the podcast, it's like 35, 40 minutes, we get heating up. But if you could just encourage the listener and in your own words, what would you say to someone who really is looking for help?
Yeah, I would say you don't have to suffer. Suffering's optional. There's so much support. It's going to require you to change things a little bit. We're going to have to change how we're doing things. We're going to have to change how we're showing up. We're going to have to change how we're exercising. We might have to change how we're eating. That might feel a little bit uncomfortable. But if you can hold that goal in mind, you can really thrive through the season. Like it really doesn't have to be this terrible experience.
Amazing.
And I'd say consistency is everything. So you don't need to overwhelm everything. Pick one thing and just be consistent with it. Do it day in and day out and day in and day out and watch what happens after 6 months or a year of just that one thing. And then layer in the next thing. Because consistency is what makes the biggest difference with your health, with your habits.
And midlife health is really boring. This is what I always say. It's like the boring habits we do every day that you should be doing. We need to exercise. We need to go to bed early. We need to drink our water.
More
we need to eat more protein. We need to make sure we get our fiber. Like it's not, I would say it's not sexy medicine, but it's those pillars and that consistency that's everything.
Awesome. I'm excited to hear how this episode affects people because I feel so much life in this conversation.
Absolutely.
I feel so much hope. And, you know, that it's not over for many women listening that have been down for a little bit about not even understanding what's going on.
Totally.
This is bringing life to them. So
Amazing.
thank you guys.
Thank you. Thanks for having us. It's
Yeah.
been really fun.
It's been a lot of
Of
fun.
course.
Yeah.
Of course.
We got to do a part 2.
I think we do.
Yeah,
More
ready.
questions.
We're ready.
Part 2. Yeah. We do have more questions. I think it was a good start.
Yeah.
And we laid out a lot of great topics. And thank you guys.
Thank you.
Thank you.
It's been
If
great.
guys want, if people want to learn more, we'll
Yeah.
put your
Yes.
website underneath.
Awesome.
Yes.
Yeah, follow
And
us on Instagram. Yeah.
Yeah, can you
Events
guys
on that
talk
6th.
about your Instagram handle and your website? Just a quick
so
shout
our
out.
website is dnhc.ca, and our Instagram is at Dr. Nic and Nat.
Awesome.